about his fertility. You can have normal erections. You can have a strong sex drive. You can ejaculate normally, feel healthy, and look physically fit. But none of those things prove that your fertility is strong. A man can perform well sexually while having a low sperm count, poor sperm movement, abnormal sperm shape, or, in some cases, no sperm in his semen at all. There is only one way to stop guessing. Get tested. Sexual performance does not prove fertility. Welcome to Alpha Circle Club. This channel helps men become stronger, healthier, more disciplined, and better informed about the decisions shaping their future. In this video, we are breaking down one of the most important male fertility tests available, the semen analysis. You will discover what the test measures, how the sample is collected, how to prepare, what abnormal results may mean, and why one result does not always tell the complete story. This video is for general education and does not replace personalized medical advice from a qualified healthcare professional. What is a semen analysis? A semen analysis is a laboratory test that examines semen and the sperm contained within it. Semen is the fluid released during ejaculation. Sperm are the reproductive cells that carry the man's genetic material and may fertilize an egg. A semen analysis is often one of the first major tests used when investigating male fertility. It does not answer every possible fertility question, but it provides a vital starting point. It helps reveal what is actually happening instead of relying on assumptions, appearance, or sexual performance. What does a semen analysis measure? A complete semen analysis may examine several different markers. The first is semen volume, the amount of fluid in the sample. The second is sperm concentration, the number of sperm found in each milliliter of semen. Then there is total sperm count, the estimated number of sperm in the entire sample. But count is not everything. The test may also examine motility, which tells us how many sperm are moving. Progressive motility is particularly important because sperm need to move forward effectively to reach an egg. The laboratory may also assess morphology, meaning sperm shape and structure. Additional markers can include semen pH, liquefaction, viscosity, and the possible presence of white blood cells. Semen volume, sperm concentration, total sperm count, total motility, progressive motility, morphology, pH and liquefaction, possible signs of inflammation. Each marker gives one part of the fertility picture. No single number should be interpreted in isolation. A man may have a strong sperm count, but poor movement. Another man may have a lower count, but better motility. That is why the complete result matters. Semen analysis does not measure masculinity. Some men avoid fertility testing because they feel embarrassed. Others believe that an abnormal result would somehow make them less masculine. But a semen analysis does not measure masculinity. It measures semen and sperm. That is all. Your value as a man is not contained in a laboratory report. Strength is demonstrated by how you respond to information. Do you hide from it? Do you blame your partner? Or do you face the result, get professional guidance, and take responsible action? Temporary discomfort is better than months or years of confusion. The test does not define you. Your response does. How to prepare for the test. Preparation matters because collection mistakes can affect the result. Your clinic should give you specific instructions, and those instructions must take priority. You may be asked to avoid ejaculation for a set period before producing the sample. Use the sterile collection container provided by the clinic. Try to collect the complete sample. Avoid ordinary lubricants unless the clinic has approved a fertility-safe option. If the sample is produced at home, follow the clinic's directions regarding delivery time and temperature. You should also tell the clinic about recent fever, illness, medications, testosterone treatment, anabolic steroid use, or any difficulty collecting the full sample. If part of the sample is missed, be honest. It is better to report a collection problem than receive a misleading result. What happens during collection? The sample is usually collected through masturbation into a sterile container. Some clinics provide a private collection room. Others may allow collection at home, provided the sample reaches the laboratory within the required time frame. The process may feel awkward. That is understandable. But medical professionals and fertility laboratories handle these samples routinely. For them, this is a clinical test, not a judgment. A few uncomfortable minutes can provide information that changes the entire direction of a fertility investigation. Home sperm tests can be convenient and may provide basic information, such as an estimate of sperm concentration or movement. They may be useful as an initial screening tool, but a home test may not examine everything included in a full laboratory semen analysis. It may not provide a complete assessment of morphology, semen volume, pH, liquefaction, white blood cells, or other important markers. A reassuring home result also does not guarantee fertility. When a couple is experiencing difficulty conceiving, or when a man has known risk factors, a clinical semen analysis and professional interpretation usually provide a stronger foundation. What if the result is abnormal? The first rule is simple: do not panic. Semen quality can vary between samples. Recent illness, fever, collection problems, ejaculation timing, medication, hormone use, heat exposure, and other temporary factors can influence a result. One abnormal semen analysis does not automatically mean permanent infertility. Your clinician may recommend repeating the test to determine whether the pattern is consistent. Depending on the findings, further evaluation could include a medical and reproductive history, a physical examination, hormone testing, evaluation for varicocele, infection testing, ultrasound or imaging, genetic testing in selected cases, referral to a reproductive urologist. Low sperm count, poor motility, abnormal morphology, low semen volume, and an absence of sperm are different findings. They may have different causes and require different next steps. Do not diagnose yourself from one number on a laboratory report. Get the complete result interpreted properly. Testosterone, steroids, and sperm production. Men who use testosterone replacement therapy or anabolic steroids should take fertility testing seriously. External testosterone can suppress the hormonal signals needed to maintain sperm production. Some men do not discover that their sperm count has fallen until they begin trying to conceive. Be completely honest with your doctor about current or previous hormone use. This is not the time to protect your ego. Your doctor needs accurate information to investigate the cause and discuss appropriate next steps. Never suddenly stop prescribed medication or attempt to restore fertility using unprescribed drugs. Seek qualified medical guidance. When should a man consider testing? A semen analysis may be considered when a couple has been trying to conceive without success. Testing may be appropriate sooner when there are known risks, including previous testicular injury, undescended testicle, varicocele, testosterone or anabolic steroid use, cancer treatment, reproductive surgery, ejaculation or sexual function problems, testicular pain, swelling or changes, hormonal symptoms, previous abnormal fertility results. A man may also decide to test before trying for children because he wants a clearer baseline of his reproductive health. Testing early is not panic. It is preparation. Questions to ask after receiving your results. Do not leave your appointment confused. Ask, which results are normal or abnormal? Which marker matters most in my case? Should the test be repeated? Could a collection problem have affected the result? Do I need hormone testing? Should I see a reproductive urologist? Could lifestyle changes help? What is the next logical step? Questions are not a sign of weakness. They are part of a responsible strategy. Powerful closing and blog promotion. A semen analysis cannot predict every pregnancy outcome, but it can reveal information that sexual performance, appearance, and confidence cannot. A man who wants fatherhood should not leave his fertility entirely to chance. He should get facts. He should understand his body. He should support his partner. And when testing is needed, he should step forward rather than hide behind pride. I have created a complete Alpha Circle Club guide explaining semen analysis, sperm count, motility, morphology, semen volume, preparation, home testing, abnormal results, hormone testing, and what men should do next. You will find the link to the full article in the description below. Read the complete guide. Share this video with another man who needs this information, and subscribe to Alpha Circle Club for more content on male fertility, testosterone, sperm health, fitness, discipline, and personal development. Your fertility is not a test of your masculinity, but taking responsibility for it is a demonstration of maturity. Stop guessing. Get informed. Take ownership.